Dornier Gemini multifunctional workstation is a premium-class lithotripter combined with a full-service urology table providing the best-in-class urological services. The Dornier Gemini has flexible therapy head positions for both under-table and over-table treatments. This ensures the patient is always lying comfortably on their back and in the ideal position for any anesthetic needs. The Dornier Gemini provides clinical staff with excellent patient access. The patient is accessible from all sides, allowing for optimal care in a variety of procedures and patient conditions. The Urology Information Management System, UIMS, is a clearly structured graphical user interface allowing for prompt data input, easy importing of data from the local database, your hospital network, or removable media such as a CD or memory stick. New patient data is easily entered manually and transferred to the local database by just clicking the Save and Select icon. As soon as the patient data is entered, a new procedure is selected and a treatment report that automatically records ESWL parameters is available. Also in UIMS is the Treatment Navigator. The Navigator allows for fast and easy input of information about location and size of the stone, patient positioning on the table, shockwave therapy head position, and imaging modality for treatment. Once this information is entered, the Treatment Navigator allows for automated patient positioning with just one button. Select the pause button on the display and follow the instructions. The Navigator controls all of the motorized movements with just one button. If preferred, you can turn off the Navigator and control the movements yourself. The automated stone positioning may result in patient dose reduction due to decreased exposures. The system will also automatically store the target's position for reference later in the procedure. The Dornier Gemini is ergonomically engineered to allow for easy reach of all required treatment components. There are conveniently located integrated operator control panels on each side of the table. These panels allow operator-controlled movements of the automated positioning at the touch of a finger. The Dornier Gemini therapy head has 4 different pressure levels from 0 to 3 to ensure proper coupling for all patients. The final treatment adjustments for both patient positioning and treatment parameters can be made at the workstation. After auto-positioning and therapy head coupling, the stone is monitored in the vertical and in the oblique imaging direction. Adjustments are done by simple image-oriented table movements. For radiation dose reduction, collimators are automatically closed to a small field of view. During shockwave release, UIMS continually tracks your treatment parameters and also displays selected parameters graphically on the monitor. Settings for energy level, pulse rate, and coupling pressure are conveniently adjusted by means of a touch screen. At the end of the treatment, the Navigator will assist you again. Just click the icon Finish Procedure and follow the instructions on the screen. All motorized movements will be controlled by just the pause button. The complete treatment report is not only recorded in UIMS, but also available on paper with a few mouse clicks. In the cases where X-ray localization is not desired or appropriate, ultrasound localization is a compelling alternative with its flexibility, outstanding image quality, and freedom of interaction with the shock waves. The ability to free scan with the transducer simplifies the pre-positioning of your patient and the stone localization. The flexibility of the transducer and articulating arm provides the operator with an easy-to-use ultrasound alternative, providing an excellent acoustic window without shadowing from surrounding anatomy. Because the ultrasound transducer is in direct contact with the patient's body and the convenient ergonomics of the control panels, you have optimum ultrasound image quality and positioning capabilities. The Dornier Gemini has the capability of dual real-time imaging. You have the ability to simultaneously use both X-ray and ultrasound during your procedure. The C-arm movements are easily operated from the table control panels. The ultrasound transducer and the articulated arm are easily accessible and do not interfere with fluoroscopic imaging. One of the unique features of the Dornier Gemini is the rotatable tabletop. Simple and quick tabletop rotation keeps the X-ray images free of disturbing contours during endourology and other procedures. The Dornier Gemini table has a wide range of table heights and tilting adjustments to accommodate any procedure. The table also features a height-adjusted table tilt mechanism, which ensures a constant table height throughout the tilting movement. The table and C-arm also have orthogonal tilting with no geometric image distortion. Extensive movement ranges in longitudinal, transversal, and vertical direction allow for excellent imaging and working conditions. The C-arm's rotational movement in the transversal plane is especially advantageous for percutaneous procedures. The height adjustment of the image intensifier allows for decreased magnification and improved image quality at lower distances to the patient. The rotational movements also include variable imaging angles in the sagittal plane. The endoscopy shelf provides flexible, safe, and convenient storage for your peripheral equipment. For percutaneous procedures, it is essential the table is accessible from both sides to avoid cumbersome patient rotation or repositioning. The Dornier Gemini, true excellence in ESWL and endourology.